Hey, it's Dr. Rucker with Reverse. I have a question from one of the patients. We're going to address that. Is the Anavar nandrolone combination similar to sermorelin? How does BPC 157 fit in? Or is it the Anavar and nandrolone are better than both? I'm going to make a video overview on these four compounds. They're all a little bit different from each other, so I made 4 different slides to review. I did choose this as an excellent question because these are all 4 different compounds that we utilize a lot. So without further ado, I'm going to answer this question. So first, I will review nandrolone. Nandrolone is a steroid compound. You see it is 19-nor testosterone. It is a synthetic anabolic agent. In the 50s, it was developed, a lot of these were developed for patients with different types of muscle wasting syndromes. But in the modern day, it enhances the anabolic properties while reducing some of the other side effects such as acne, even gynecomastia. So nandrolone is a steroid. That makes it different than sermorelin, makes it somewhat different than Anavar because I'm going to review Anavar. And then BPC I'll review, and BPC and sermorelin are examples of peptides. Anavar and nandrolone are examples of steroids. So nandrolone is classically excellent at enhancing muscle building. So you'll see enhanced protein synthesis, nitrogen retention. Nitrogen is one of the key aspects of amino acids, which is key aspect of protein. That's what that means. Accelerated muscle tissue repair. Many patients do say joints and ligaments heal better when they take Anavar. It does increase red cell production, so all patients on testosterone and nandrolone do need to donate blood frequently. You have to take testosterone with it. It suppresses your natural testosterone. So if you were to just take nandrolone by itself, you'd find your testosterone goes to 0. So that's an explanation of nandrolone. It's strictly an anabolic steroid. So on to Anavar. Anavar is oral. Nandrolone is an injection. That's a difference. Anavar has a little bit more relationship to fat loss, muscle gain. It's a mildly liver toxic. We like to check liver laboratories. No breast swelling. So it's less of a testosterone analog. So basically increased recovery, endurance. Bodybuilders suggest it makes you more veiny, meaning it has a lot more definition qualities for that look. And fat loss is one of the number one things Anavar does. So it's an oral tablet. It is a anabolic steroid, but it has more of a fat loss type effect in the steroid family, and it's an oral tablet that you take daily. So that's differentiates Anavar from nandrolone, and I'm about to go through the other 2. Now I'm on to BPC. BPC is in a league of its own. It's a peptide. It is a healing peptide. So it doesn't have any of the type of effects that a steroid compound would. It wouldn't cause increase of muscle. It wouldn't cause weight loss. It causes wound and tissue healing. It does have other anti-inflammatory properties, lower blood pressure, pain reduction. Due to the anti-inflammatory nature, it can cause a reduction of fat mass. Mild anabolic effects, but it is not an anabolic steroid. Of course, these properties make it an anti-aging compound, increases in well-being. We're finding a lot more effects of BPC over time. Any of you guys that watch podcasts, Huberman talks about it as remarkable. He took it, he healed his L5 compression. So anyone dealing with injuries, interesting, he had injury after performing deadlifts. He took the BPC, he was pain-free quickly. So phenomenal compound for athletes. Muscle recovery, allows you to train harder, decrease soreness. So almost a natural ibuprofen, if you will. All right, in this write-up, they're saying it's an anabolic peptide. Maybe. I'm not going to say that's one of its key properties, but keep in mind it's a peptide, not a steroid. Oh, and of course, you have to inject this daily, so that's important to realize. Subcutaneous injection. Nandrolin's a muscle injection like testosterone, and then Anavar, I said, is a oral tablet. And I'm going to move on to the last one, which is sermorelin. Sermorelin, like I said, is a peptide. What sermorelin does is it causes the pituitary to release more growth hormone. So growth hormone pricing ends up being anywhere from $1,500 a month to $3,000. That's pretty expensive. Sermorelin's run classically in the 350 to 500 range, depending on supply chain. So you can see it's vastly different, but it is a growth hormone stimulator. Anything that increases human growth hormone will cause growth and repair, increase muscle mass, burning fat. I think of all the 4 compounds, this one's the most subtle. You probably have to take it for 6 months or so to see good effects. BPC, you saw Huberman saw an effect in a week. The other 2, you'll see effects in anywhere from a couple weeks to 6 weeks. Sermorelin would take a little longer for growth hormone to actually start to increase the natural release of growth hormone and create youthful levels. It just ends up taking longer. I just picked the first benefit here, increased energy and vitality. Multiple clinical studies have shown that sermorelin can increase energy levels and vitality, especially if you are deficient in growth hormone. So this is a peptide, and I explained the other 3. Other than this type of overview, all these substances have a lot of research articles, a lot of podcasts. You can find a wealth of information. I just wanted to give you an overview from me, the medical doctor, on this topic. Thank you for watching, and reach out for any questions.